Today, we are going to evaluate a patient who was referred by a previous dentist with a fractured instrument in the root canal system, where the majority of the file has extended beyond the apical foramen and is located within the bony tissue. After removing the temporary restoration, rubber dam isolation was established, and the fractured fragment was visualized under the microscope. Using a Gates Glidden (GG) burr, the coronal portion of the fractured fragment was exposed. Visualization of the cross-section after removal of dentin from the coronal aspect of the fragment. Broken instrument. The fractured fragment originated from a hand file that separated during an attempt to bypass the initial fragment. Using a modified Gates Glidden (GG) burr, a minimum clearance of approximately 0.1 mm of dentin is created circumferentially around the fragment in all directions. Sufficient space was created circumferentially around the fragment in all directions. Using ultrasonic instrumentation, adequate space was created on the buccal and lingual aspects of the fragment to allow loop penetration. The largest needle and wire device which file in the prepared area beside the broken file. Given that the fragment was completely locked within the canal, insisting on the use of an ultrasonic tip, as the sole retrieval method would have resulted in further fracture of the fragment. Therefore, a Zumax loop, command, size 150, was used for retrieval of the fragment. (14 mm) broken instrument. Finally, the canal was obturated using AH+ sealer with the warm vertical compaction technique. Tooth was successfully saved.